This is Brooke Baggett from Moses Cone, and today I'm going to be talking to you guys about nicotine replacement therapy. Now, we all know about the dangers of smoking, and we can see from this picture just a few of the terrible chemicals that are involved in the traditional tobacco cigarettes. We have, I think the number is closer to 7,000 chemicals, 400 of those are toxic, and as far as we know, at least 43 are known to cause cancer. Now, the contents of cigarette smoke, again, they have all of these chemicals that we can recognize: acetone, aluminum, ammonia, arsenic. We are very familiar with carbon monoxide, and there's even DDT, formaldehyde, lead. All of these can be within a traditional cigarette. And we've seen this picture many times before between a non-smoker's lung and a smoker's lung, and we can recognize that this is something that is very bad for a patient. Apart from that, we know the health risks related to smoking. Smoking affects all sorts of systems within the body. So starting with our central nervous system, it does constrict blood vessels. So patients that smoke will feel lightheaded. They may get headaches, dizziness, irritability is common. We know it also increases heart rate. So this will increase our blood pressure as well. It can cause tachycardia, maybe even some arrhythmias. And again, we're seeing that artery constriction. Another big thing with smoking is the risk that it can have on children, as well as some long-term risks as far as being a risk factor for type 2 diabetes, obesity, hypertension, and maybe even some neurobehavioral defects. So there are a lot of negative health risks related to smoking, and that's one reason why we want to let our patients know that they need to quit. Now, nicotine addiction is a very complex issue, and a lot of the literature focuses on these three main kind of areas that nicotine addiction touches on. One of those being the biological side, so that people will have physical addictions, and that is characterized by withdrawal symptoms. And when they actually use cigarettes or smoke, they get relief from that, which is their reward. There's also the psychological side, so people have these paired activities. Every morning with breakfast, I have my cigarette, or every time immediately after I eat lunch, then is when I have my cigarette. And these become more routines or habits, and that feeds into the addiction of having triggers, right? Every time I drink my cup of coffee, I have to have a cigarette in my hand. Stress management is also a big part of nicotine addiction because people tend to smoke when they're very stressed out, and it tends to help them cope with emotions. So that's another kind of area that nicotine addiction touches on. And the last one is social, and this is one we're seeing pretty commonly within our younger adult population, that there is a social connection that they have with each other when they're going to an event and many people are smoking, then they also feel that way. It also does not help if you have a partner that smokes, and it's a lot harder to quit if that is the case. Now, nicotine withdrawal, once a patient stops smoking, there are lots of withdrawal symptoms that take place within the days to weeks following. And this chart just breaks that down a little bit. So patients start off by having this lightheaded feeling that may last a couple of days. They, for the first week, may notice some disturbed sleep because, again, they're having all of these psychological and physiological changes that are starting to occur. Within 2 weeks, the cravings will heighten. People may have poor concentration, or some will have to start to have a cough. At 4 weeks, we start to see some depression or restlessness, irritability, anger, and then at 10 weeks is really when people get their appetite back. So that's important to know when you have a patient that you're helping quit, to let them know withdrawal symptoms should be expected, and they help you to help tailor the conversation to let them know what they can expect. Now, once you start the conversation of helping a patient to quit smoking, there are these 5 A's which can help you to walk them through the quitting process. Ask, advise, assess, assist, and arrange. They're all very commonly used when helping a patient to stop. So first you want to ask the patient really about why they want to quit and if they've tried anything in the past. That's going to really help you to tailor your conversation. You also want to advise the patient about the process of quitting smoking, why it's so important. Talk about those things like how many terrible chemicals are in cigarettes and the negative health effects that smoking has. And then assess, really look and see if the patient is ready to quit smoking. Are they there yet? Are they just asking, but they're not quite ready for a change? But once you've assessed them and realized that this is something that they are ready to do, they're in the moment of wanting to change, is when you will start to assist them. So part of assisting a patient in quitting, you want to start with a quit date. Let the patient decide on what day they want to quit. Usually it's within a week of the conversation. You also want to incorporate family, friends, and coworkers. This will help them stay accountable for that quit date. You want to tell them to anticipate challenges, including all of those withdrawal symptoms we talked about. And then removing tobacco products from the environment will also help the patient. Lastly, you want to arrange a follow-up plan. This is really key when it comes to helping patients remain abstinent from smoking. We have some quit lines available in North Carolina that they can use, or there are lots of online resources, but time the follow-up to have maximum impact. So you don't want to schedule the follow-up too soon to where the patient is just in that initial phase. You really want to time that follow-up so that the patient is going through the withdrawal symptoms and you're able to be there for them throughout that time frame. So now we're going to move into talking about nicotine replacement therapy. So what are the nicotine replacement therapies? Well, they're used to help people who are in the process of quitting smoking, and they provide the person with nicotine without those harmful chemicals that smoking cigarettes causes. Studies show that a person is 4 times more likely to succeed in quitting with the help of a smoking service and nicotine replacement therapies. So that's really key, that these nicotine replacement therapies have been shown over and over again to be effective in helping patients to succeed in quitting, but also realizing that there's a behavioral component that is where you can step in as a provider. There are many different types of NRTs. You have your traditional nicotine-based approaches, and then you have non-nicotine medications that you can also use. So I'm just going to walk through these for class. So the first ones are nicotine patches, and the 2 biggest ones that people recognize are Habitrol, or the generic nicotine patches that you can now buy, or Nicoderm CQ. Really, the dosing is not as important, except to realize that you want to start at the higher dosage and then taper them down over time, usually over 4 to 8 weeks time frame. And they will apply the patches daily, and remember to remove them through before the next day. So just some tips for prescribing. You want to tell the patient not to smoke while they're using the patch. They want to place it firmly onto a relatively hairless location, and again, replace the patch daily while alternating sites. One of the key things is to remove patches at bedtime, especially for patients that will come to you with sleep disturbances. We usually tell people to remove them at bedtime to help them to have better sleep. The next nicotine replacement therapy is Nikka Trouble NS. This is a nasal spray that patients can use. Again, you want to taper this over 4 to 6 weeks. And for the nasal sprays, you want to avoid these in patients with asthma and chronic nasal disorders. Of course, that inflammation in the nasal passages will prevent that nicotine from actually reaching the patient's lungs or tissues. And really knowing about the side effects of this, you're going to have some nasal irritation, possibly runny nose and throat irritation, watering eyes, sneezing and cough. So this one has a few more side effects to be aware of. Next is nicotine gum. This is a pretty popular one as well. Nicorette is the common brand name for this. And really depending on how severe the symptoms of withdrawal are is going to depend on how often a patient is chewing the gum as well as the milligram dose of the gum. This is something that is usually tapered over several months, unlike the ones we've previously talked about, which are usually 6 to 8 weeks. When talking about nicotine gum, we want to make sure that patients know to take just one piece of gum at a time, and usually on a fixed schedule is what's best and what helps patients the most. They want to chew the gum slowly until they get this peppery taste, and then they want to park the gum, which is basically just putting it into their cheek and leaving it there to let that nicotine penetrate the gum area. And once they lose that peppery taste, you can advise the patient to chew again and then park the gum again until it completely loses its flavor. There are several flavors available so that can help patients. One of the key things is to avoid acidic beverages within 15 minutes of chewing. This can just interact with the actual gum coming into contact with the mouth. Nicotine oral inhalers, we really think about having that initial treatment up to 12 weeks and then tapering off. Again, this is one that's over several weeks. Again, this, because it is an inhaled formulation, you want to have caution in patients with asthma or any sort of chronic lung disorders. Best success is achieved by continuous puffing for 20 minutes with the inhaler, and the recommended duration is 3 months, followed by 6 to 12 weeks of gradual reduction. So this does, again, take a little bit longer than some of the other ones to actually have that gradual reduction. Nicotine lozenges, the Nicorette lozenges are, again, the more common ones. And the dosing of this is based on the time to first cigarette. So if you talk to a patient, they say, I have to have that cigarette first thing in the morning, then you'll want to start at that higher dose. And again, with all of these, the fact that it is at a fixed schedule is going to really help the patient to eventually taper off. Just like with the gum, you want to make sure you're not eating or drinking 15 minutes before using the lozenge. You want to suck on the lozenge until it dissolves. You have a lot of patients that will suck on it for a while and then swallow it or chew on it, but we really want to advise patients to just suck on it until it dissolves. The recommended duration for the lozenges is 12 weeks. Again, it can come in several different flavors, which may help. In the side effects with this one may be a sore throat, vomiting, indigestion, or excessive salivation. And so that is something to make sure that you advise the patient on. Now getting into our non-nicotine products, the bupropion is our first one, or Zyban. This is a drug that is commonly used in depression, but it can also be used for smoking cessation. It is contraindicated in seizure disorders because that is a side effect of bupropion. It can precipitate a seizure if people are inclined to having seizures. There is a black box warning for mood changes, so that's something that you want to advise the patient on and to make sure they contact you if they do notice any sort of mood changes. Patients can continue to smoke while initiating this drug. And we tell people they can take it with or without food and to make sure they continue treatment for 7 to 12 weeks. With this one, one of the more common side effects is dry mouth and insomnia. Next, a pretty popular one is varenicline or Chantix. This is something that you will kind of work up to taking, and then after day 8, you will continue on 1 milligram dosing twice daily. They do provide Chantix in a starting month pack and a continuing month pack. So at starting month, again, it will work the patient up to the maintenance dose, and then they can start getting the continuing month pack, which is all of that higher dose. Again, this one has a black box warning for mood changes, so that is something to be aware of. Again, you can continue to smoke while initiating Chantix. And for varenicline, you want to make sure you take with food to avoid any sort of upset stomach, and can continue treatment for 12 months. This one does have a caution for patients who have alcohol use or history of seizures, so please be aware of that.